So my name is Pundrique Sharma. I'm a consultant plastic surgeon in Liverpool and the Northwest. I have two parts to my practice. My National Health Service practice is based at Alderhay Children's Hospital and revolves around treating children with birth defects following trauma, rare cancers. And my private practice revolves around cosmetic and aesthetic plastic surgery. I was a very nerdy kid and I liked science, and being nerdy and liking science left you not many things to choose to go into when you got older. And I really liked biology, and I really liked the human body, and it was just fascinating. It was fascinating that the whole thing could work properly, that it didn't fail more often. You know, the more you know about it, the more you're like amazed that it actually works 99% of the time. And so kind of like, okay, well, you're going to go to university, you have to pick something. And it seemed like a natural home for a nerdy academic kid, medicine, who liked the human body. And I also had an uncle who was a local doctor, local police surgeon back in the day, and he was just like the nicest, coolest guy ever. And he would have these awesome exploits of things he saw while he was a doctor. And I thought, I've got to do this. I have to do this for a living. It just seemed so cool. So yeah, that's why. I mean, nothing more exciting than that. So what made me choose my specialty? What made me choose plastic surgery? Okay, well, it was a kind of decision by default and by virtue of the people I met along my pathway. Like when I was at medical school and as a junior doctor, I went through everything. I wanted to be a cardiologist, I wanted to be a pediatrician, I wanted to be an obstetrician, and I wanted to be a cardiac surgeon. And eventually I decided I was going to be an orthopedic surgeon. That was it. I was going to be an orthopedic surgeon. And when you're training, if to do orthopedic surgery, it's a good idea to do some plastic surgery. And I did that at University College London, and it was amazing. It was the first time that I felt like I was treated like a surgeon, I think. So I got to do the operations and you sort of saw the concrete differences in the patients that you made. And often it was a very immediate, gratifying difference. It was kind of selfish, right? You like that. And I was trained under the auspices of three people who I remember very well. So there's Juling Ong, Helen McAvoy, and David Floyd were my seniors when I was in University College. And they were just the nicest, coolest people. They were so kind, they were caring, they were supportive. And I was like, okay, I've got to do this. This has to be it. And here I am. So what do I find most rewarding about my job? Okay, well, look, from a very personal point of view, I guess the first thing is the technical aspects and the problem solving, right? It's nice to be presented with something. How do you deal with this? How do you manage this? You think about it and you come up with an answer, and then you do it. Like, you actually do it. And that's like, you don't send someone else to do it, you do it yourself. And that's tremendously satisfying. And again, as I think I mentioned before, a lot of plastic surgery, you see the result immediately, which is very satisfying. And to see the results on people, like, who doesn't like to see happy people? Who doesn't like to do something and to see people you've made a difference to? So I think that's a massive thing. Teaching, it's really great to teach junior doctors and watch them progress, like you progressed at some point, and to become something special, to become something good. That's really very satisfying. And most of the doctors we train over a period of a year, so you can watch the difference. You can watch the difference in them. And you know, I guess I'm very lucky to do a job that I can be proud of doing. You know, and you know, my kids are proud that I do. I guess, I hope. So, what do my patients value about me, and what do I value about them? If you want an honest answer to that, you really need to ask the patient. Because obviously I'll be biased. But what I would hope they would say if you ask them is that I genuinely care. I hope I do care, and I genuinely hope that they believe that. I think that's really, really important. What do I value about them? Well, you know, I love my job. Like it's my life. It's kind of a purpose, isn't it? It's like what I do. And if you can't say it, you can't provide a unifying answer about what is good about all patients. Every person is different, any more than I could about, you know, what do I value in my friends. Each one is different, but my patients give me purpose, and that's what I value most. So at work, how do I behave in frustrating, stressful and difficult situations? Okay, so that's very common situation, particularly in the National Health Service, where I deal with a lot of trauma and accidents. And in fact, we had a child a couple of days ago who, following an arrest, essentially had something happen that meant that they were at risk of losing their leg. So this is the job, and this is the best part of the job and the worst part of the job. And that's why you pay the government to pay us. It's to deal with these kind of situations in fairness. And for a really truthful answer, as I've sort of said before, for another question, you'd have to ask those around me about how I deal with it. But I think the way that I hope I approach it is the first thing you need to do is to get, well, what you are trying to ultimately do is get control of the situation. Something's gone wrong. Somebody's having an arrest, or somebody is about to lose a limb, or whatever it is. You have to get control of the situation in order to be able to effect a difference, right? It has to start with control. And in order to get control of the situation, you have to get control of yourself first. So really the question is, how do you get control of yourself first? And when I was a kid, my dad used to teach me these breathing exercises. You know what it's like when you're a kid, you're like, okay, whatever, dad. And he's like, no, you have to do it. It's like, fine, do it. But actually, to this day, it genuinely helps, right? Like, and I've read various explanations of why it kind of slows down it favors the parasympathetic over sympathetic nervous system. It doesn't really matter what it does. It works. It calms you down. So I've never regretted taking 10 seconds to breathe slowly to work out the situation. That's the first thing. The second thing is to have faith that you and your team can sort it out. Like if you lose that faith, you can lose the plot very easily. Even when however bad it's looking, you've got to have faith that this is a resolvable situation, and then you can act.